It is exactly 8 minutes after 11 o'clock. This is the mid-morning show. It is June the 16th. I just spoke about the significance of this day, and let us not enjoy the day without reflecting what happened 50 years ago in Soweto. And of course, when one of the iconic figures of June the 16th, 1976 was Hector Peterson. Let's share those stories amongst our young people today. But right now, we are going to be talking with Dr. Gagu Matsebula, a member of the South African Society of Psychiatrists. We are going to be breaking the silence on men's mental health issues. A very good morning, Dr. Gagu. Welcome to the program. Lovely to have you here.
Good morning. Thank you for having me.
Absolute pleasure. I am saying your name correctly, am I not?
Yes, thank you. I appreciate it. Thank you so much.
It's a pleasure. Lovely to have you, as I've said. Okay, so I'm not sure what's the situation like globally. I should imagine in the Northern Hemisphere, particularly in the West, men's mental health issues are not viewed through the lens, through the stigma lens. But I'm wondering what the situation's like in South Africa. And as we here in South Africa recognize Men's Mental Health Month, how would you, doctor, describe the current state of men's mental health in our country? And what are the most concerning trends you are seeing?
Thank you ever so much. Thank you ever so much for that question. Indeed, in South Africa, men's mental health is showing that it is not in the healthiest of states, as evidenced by the poorer health outcomes that men are experiencing individually and collectively as well. There are several studies that have been done, and that those do highlight that things are really not looking too well for men. One of the studies that comes to mind shows that approximately 80% of homicide deaths and 76% of road traffic fatalities involve men. And this seems to be leading to this unhealthy presentation of men's mental ill health. And that's something I'm happy to get into with you at a later stage. But that's where we are. And one of the compounding factors is that men as a demographic are less likely to engage with healthcare services. And this is what then leads to them dying from illnesses that can be very easily treatable, diseases that can be very controllable. And we find that because of that, they then display these poor health outcomes as evidenced by the stats that I gave you a few seconds ago.
So clearly what you are suggesting is when you talk about homicides, when you talk about road accidents, etc., you are saying that we've got very angry men in our society, and the slightest thing can tick them off. And that is perhaps one of the reasons too why we're seeing high incidences of road rage and GBV issues, and of course femicide. Would you say all of this then perhaps leads to the issue around men's mental health and well-being?
Thank you for that. So just to one point, when we look at things like the based violence and femicide, as psychiatrists, we have noted that mental ill health is usually not the reason that leads to these really devastating crimes, but rather we see that the propensity there is from cultural norms or societal expectations, which then lead the perpetrators of these crimes, largely men, to express their dominance in those really painful ways. In terms of the expression of anger and frustration and irritability, that leads to something we call
You got 3 minutes, it's fine. Go ahead, breaks.
I've lost you there. Sorry, I lost you there.
Hello?
Yes, can you just repeat what you were saying? I had lost you there for a minute.
Oh, sorry about that. So I was saying that there's something called restrictive emotionality, and words, in essence, refer to the tendency for men to suppress or inhibit their emotional expression because vulnerability is viewed as being incompatible with masculinity.
Mm-hmm.
So instead of a man feeling comfortable to express sadness or fear or worry, it's more comfortable and societally acceptable, unfortunately, for a man to express irritability or aggression or poor impulse control or reckless behavior, which is what then leads to these poor mental health outcomes for men.
Okay, let's go for an ad break. When we come back, we'll continue this very important discussion, very especially June the 16th. And we do know that the uprising 50 years ago, at the forefront, we had lots of young men in their teens. And I kind of wonder that, one also wonders with the young people today, how do they then try and get rid of pent-up energy? And if one is not dealing with energy, negative energy, in the correct way, does that result in very poor and possibly devastating outcomes? But you can respond to that after we take our ad break. Thank you for being patient.
Thank you.
Rejuvenating media day by day. This is Salam Media.
Hey, Gulam.
Yeah?
Did I return your lawnmower last month?
No, bhai, you didn't.
Oh, no. Now what'll I do? I wanted to borrow it again, man.
With Randry Jewelers, you won't have to borrow or lend because the prices are so well trimmed on all gold and diamond jewelry. Alternatively, we could remake your old jewelry into a brilliant new design. Visit Randry Jewelers at 151 Stevens Lamini Road, Musgrave, Durban. Randry Jewelers, the family name you can trust.
When the perfect blend of stylish decor, exquisite halal cuisine, and warm hospitality come together, it could only mean Al Bayt Lodge, your true home away from home. Al Bayt is the ideal heaven for families, business people, and tourists with its 4-star family rooms and other luxurious facilities, conveniently situated close to Port Elizabeth Airport, the beach, and other amenities. Your stay will be truly unforgettable, as you'll be taking home lasting memories of the warm hospitality, the serenity and tranquility that Al Bayt has to offer. For reservations, call 041 583 6415 or visit www.albaytlodge.co.za.
Gaza needs your support more than ever. Homes have been shattered and families have lost everything. With your support, our teams are delivering clean water tankers, feeding the hungry, and assisting orphans who have no one left. Let us give Gaza whatever help we can. African Muslims Agency, empowering, educating, inspiring.
Are you banking with convenience, transparency, and flexibility? With Al Barakah Bank's transactional banking account, you can enjoy convenient everyday banking designed around your needs. Benefit from zero fees on point-of-sale transactions and manage your banking easily through Al Barakah's secure mobile banking app and internet banking platform. From everyday payments to managing your personal or business banking, Al Barakah makes banking simple, transparent, and convenient. Visit albarakah.co.za to learn more. Al Barakah, your partner bank. Al Barakah Bank Limited is an authorized financial services and credit provider.
Breaking stereotypes, moving boundaries, joining hands. Salam Media. Humanity sets the agenda.
Welcome back. It is 17 after 11 o'clock. Our first guest on the show today is Dr. Gagu Matsebula. He is member of the South African Society of Psychiatrists. We're talking about breaking the silence on men's mental health. Welcome back, Doctor. Would you like to respond to the comment I left you with just before the ad break?
So yes, thank you for that. I think, when we speak about men's mental health, It's very important to realize that men are a demographic, and that because they are a demographic, it will be extremely beneficial to them for there to be policies that are directed towards getting men into healthcare sectors. You know, the moment we introduce stigma into the conversation relating to health, death tends to be the outcome. And we've got a really painful example that we can draw from, and that was of HIV and AIDS. When HIV came into our collective awareness, there was a lot of stigma around it.
Right.
But now if we look at where we are, we're able to talk about HIV, and we've had a lot of public campaigns about this virus. And we look at where things are now in terms of HIV. And I strongly feel that the same thing does have to happen for men's mental health.
So I should imagine it would apply to the men who struggle in silence regarding social, cultural, and personal barriers that prevent South African men from seeking professional help or perhaps even speaking openly about their mental health.
Absolutely. And I think one of the factors that tends to inhibit men from being able to speak out freely is the lack of safe spaces where men can speak openly without the fear of being judged or ridiculed. And in this instance, I think families, workplaces, social groups, schools, faith-based organizations, communities, I think we all have a role to play in changing how we as society understand masculinity as well as emotional health. And I think one of the things that I regularly tell men is that, you know, when we're watching an athlete, so we have the World Cup going on at present, and the athlete does not attain what he wanted to attain or his team lost. We regularly see these athletes breaking down in tears and crying right there on the field, and they don't hide it. And we're fine with that as society. And I tell men that if we can extend that amount of understanding to an athlete on national TV or on a worldwide platform like the FIFA World Cup, then surely we can extend the same understanding to a man expressing his fear or his worry, regardless of where he expresses that feeling.
So, Dr. Gagu, what are some of the warning signs that indicate a man may be experiencing depression, anxiety, or any other mental health condition? And when should loved ones encourage them to seek professional support?
Thank you. Such a beautiful question. Thank you. So common signs to look out for is a change in man's mood. Is he a bit more irritable than we know him to be? Is he a bit more angry than we know him to be? Have we noticed that he's no longer enjoying things that he used to enjoy like he used to before? Is there a change in sleep? Is there a change in appetite?
Are you still there, Dr. Gagu? Okay, let's just see if we can reconnect with Dr. Gagu Matsebula. We are talking men's mental health in South Africa and breaking the silence. You're back there, are you?
Yes, I am. Terribly sorry. We
No
seem to have
worries.
horrible connection.
No
Apologies.
worries. No worries. If you just want to, if you'd like to repeat what you were saying, and then I'll go on to our final question.
Of course, I'd be happy to. So if we notice a change in the man's mood, if we notice a change in his enjoyment of things that he used to enjoy previously, if we notice a change in sleep or appetite, or we start to see unhealthy coping mechanisms like the usage of substances or a reduction in libido, those are usually the early warning signs that there's something going on. And what families or friends or society can do is just to ask, we notice that you're more quiet than we know you to be. What's happening? Do you want to tell us about it? It's such questions that can help the man to begin to talk. Or alternatively, we can chip in and help with whatever responsibilities that he has. And while we do that, we can advise him that maybe you should go for a checkup with your local doctor because we're a bit worried about you. That should help.
So, Dr. Gagu, would your first port of call be your local GP or a psychologist or straight to a psychiatrist?
The local GP or family doctor is an excellent place to start. They are the absolute foundation of our healthcare system in this country. And they are able to manage some of these conditions. And they also do know that if things become complicated or the complexity of the illness now requires a specialist, they will happily make that referral. So please start off with the GP, please.
Okay, so looking ahead, what practical steps should government, healthcare professionals, employers, communities, family members, spouses, all of us involved promote early intervention and ensure that men have easier access to mental health services?
Thank you. So I think a nice start would be the state. It's the state that tends to send the tone and the trend, particularly for something as serious as health. So I think South Africa could do well to invest a bit more into the public health budget for mental health. Currently, South Africa only allocates roughly 5% of the public health budget to mental health services, which is significantly lower than the 10 to 15% which is recommended for lower and middle income countries. That would be the first step. The second step is for there to be more public awareness campaigns. We need to normalize men being able to speak about their health and ill health. We need to come up with campaigns encouraging men to have preventative mental wellness habits like exercise, healthy sleep, stress management, and proper nutrition. Then in terms of society, I think we can and must change the way we view masculinity. We must encourage men who promote healthier masculinity norms. And I think if we can do this cumulatively and consistently, the prognosis should be good, as evidenced by what we've been able to achieve with HIV.
Absolutely. Please, God, let this come to be. Dr. Gagu Matsebula, member of the South African Society of Psychiatrists, thank you indeed for talking to us about breaking the silence on mental health in South African men. Thank you so much. God bless.
Thank you ever so much. I appreciate it. Thank you.
Soweto, it's time to stand together for justice, peace, and solidarity. Join us for the annual Soweto Walk for Gaza, taking place on Saturday, the 20th of June at 7:30 a.m. The walk will begin at the historic Regina Mundi Church and proceed to the monumentous Dlamini Mosque, bringing together people of all faiths, backgrounds, and communities in a powerful show of unity and support. Bring your family, friends, and fellow residents as we walk together for a common cause. Let your voice be heard and your presence counted. That's the annual Soweto Walk for Gaza, Saturday, the 20th of June at 7:30 in the morning, starting at Regina Mundi Church and ending at Dlamini Mosque. Together we walk, together we stand, together we show solidarity.